Hello and welcome to our special episode of World Heart Day 2025 series, Heart Matters 2025 Experts Insight for Every Beat. This series is designed to bring you powerful, bite sized conversation with India's leading heart health expert so you can take simple, proactive steps to protect your heart. Today, we are focusing on India's rising heart health burden, why heart disease has become the leading cause of death in our country, and what we can do to change this narrative. And we know that prevention, innovation, and access to care is the key. And our guest today is the perfect voice to guide us through this critical discussion. We are honored to join by Dr. Haresh Mehta, Senior Interventional and Structural Cardiologist at Lilavati Hospital and Research Center, Mumbai. With over 35 years of experience, Dr. Mehta is renowned for his expertise in complex coronary intervention and advanced valve therapies. He is among India's foremost specialists in TAVR, having performed over 1,000 procedures, and is a passionate mentor who has trained DNB cardiologist student and cardiologists across India, internationally as well. His pioneering work and dedication to advancing interventional cardiology have earned him recognition nationally and globally. Thank you so much, Dr. Mehta, for joining us for this episode, and it's great to have you with us here today.
My pleasure, Simran. I'm glad to be here.
Thank you so much, sir. So, as you know, this discussion is for a very important topic, which is our heart health, India's rising risk of heart attacks. So, focusing on that we know that India is witnessing a surge in heart disease, and it is now the leading cause of death in our country. So, could you help us understand the key statistics and why this burden is growing so rapidly, even among the younger population?
So, if you see that there was a study that came in 1990, cardiovascular and stroke, but we both put them under vascular death, accounted up to 13% deaths. And by 2017, it rose up to 27%. And this is just a conservative estimate. It's not the true estimate will be so much more than that. So, one third of all deaths, I would say, in our country are happening to cardiovascular disease. So you can imagine if you have a population of 1 billion plus, so one third will be around 300 million will be exposed to this risk of coronary artery disease and vascular disease, which is a huge burden. And year on year, the number of deaths are increasing every year due to this cause. And the disturbing trend that has been noticed in our country compared to the Western world has been the younger age group that is getting affected in our country. So the people who contribute to the economy are the ones who are falling prey to this. So younger age groups, more diabetics, more hypertensives. So in case, if you really see as amounts of economic terms, we are losing close to $1.7 trillion annually in this problem because of the cardiovascular health problem. So you can imagine what our country is facing. It's like an epidemic.
You rightly said, sir. It is an epidemic, and in terms of money, in terms of human resources, we are losing a lot of, valuable things of our country. Moving on, that we have always heard our experts say that prevention is power. Prevention is the better intervention. So, what could be the most crucial preventive steps that individual can take in terms of the lifestyle, diet, and regular checkups to reduce their risk of heart diseases?
So I classify preventive strategies into individual and collective. So collective is the responsibility of our population, doctors, and government agencies to create awareness of heart disease and what we need to do. At an individual level, we need to change our lifestyle. So basically, cardiovascular disease is a lifestyle disease. It is caused due to our problems, our habits. So we as Indians generally are genetically more prone to heart disease because of our gene pattern. So we generally have more metabolic syndrome. So we have more central obesity, more sugar, higher cholesterol, more diabetes, and we are generally sedentary and carbohydrate consumers. So we eat more of sugars and carbohydrate. So what I would advise our younger people to start early, start at probably in your teens to modify your simple things in life. Exercise every day. At least try to do something for 20 to 30 minutes. Play a sport outside the house. So start by doing that. Nutritionally, be aware of what goes into your mouth. It's very important. So you should know that. I'm not saying that don't eat chocolates or don't eat cakes or don't eat junk food, but that should be once in a while. Most of the time, you should be eating nutritious food, which is rich in nutrients, which is rich in protein, less in carbohydrates, less in saturated fats. So maintain a good diet. Third, sleep adequately. What has happened with the boom of the internet culture and cheaper plans for surfing and data, plus available time, and then you are working and constantly online. So you spend a lot of time on screen, and this screen time robs you of the most important element of health, which is sleep. So we don't sleep enough. We don't sleep good. And all deprivation of sleep eventually can lead to diabetes, blood pressure, bad nutrition, sedentary lifestyle, and eventually to heart disease. Fourth is addictions. Again, as the globalization occurs, urbanization occurs, the amount of money available with younger people has risen over time. During our time, we used to get 1 rupee probably a day to spend. And nowadays, a teenager would probably earning anywhere between 25K to 50K. So he has a lot of disposable income with him. And that leads to more of bad lifestyle. So you indulge yourself more in bad food and then eventually fall prey to addictions, which is the worst of which is smoking, drug addiction, alcoholism. So all this leads to eventual, again, blood pressure, diabetes, heart disease. That's the one more step. And last but not the least, in the competitive world, we are always wanting to be one step ahead of your contemporary. So in that race of reaching the goal post, which we really don't know what the goal post is, but we still running to a goal post which we don't know, and that leads to a lot of stress. And the stress again leads to a lot of problems with your hormones, your imbalance. Again, your lifestyle changes. You don't sleep. Your food is bad. Your drinks are bad, and you may end up with diabetes, blood pressure, and heart disease. So, if you can take care of all these factors, moderate your expectations, keep away from addictions, sleep well, meditate, eat well, exercise, meet friends, play, and of course, work too. I'm not saying don't work.
Very rightly said, sir, and in a very proportionate way, how we can manage our day without taking much of stress and being aware of what we are eating, in how much amount we are eating. So to keep a balance of it, to keep a check of it, I
Yeah.
think we can lead a very healthy lifestyle. It is all in our control. Nothing which is out of our control, and we cannot take care of all those things. I
And
think
Simran,
we,
you use the key word actually
yeah,
balance.
yes.
That is the word. Moderation and balance is the key to a happy and healthy heart.
Very rightly pointed out, sir. And thank you so much for this advice to our listeners out there. And I think we all need to follow this kind of lifestyle, sir. Moving on to my next question. So, in the last few decades, we have seen that cardiology has seen an incredible innovation. From minimally invasive procedures like TAVR to AI-enabled diagnostics and remote monitoring. So, how do you think these advancements are changing the outcomes for patients?
So when let's talk a little bit of TAVR. When there were patients with valve disease who were old, were inoperable, they were frail, and the surgeon said, "We can't operate you, we can't replace your valve." So the medical community got together and said, "Ki, how can we just tell someone that you're not going to be able to do something for you or you're going to be left to die?" That's how the minimal invasive TAVR, which is the without surgical replacement of aortic valve, came through. And so on and so forth. The advances have gone to mitral valve diseases where we use clipped valves to stop the leaking of valve. You can also replace the mitral valve, you can replace the aortic valve, you can replace all the valves in the body without surgery. So that's one aspect which is very exciting and it's still going to grow further and further. The second advancement has been the prevention of stroke in patients with atrial fibrillation or rhythm problems. All this time, we use strong blood thinners to stop the stroke from happening in patients with these rhythm disorders. And we realized that many of our patients started bleeding more because they are very strong blood thinners, which added to problems of other besides preventing stroke. So now there are devices which can be put into the heart from where the clot comes, and the patient can be away from these strong blood thinners, and the risk of bleeding goes down. At the same time, maintaining the benefit of preventing stroke. And last but not the least, AI, which is being badly abused and badly shamed for that it's going to take the job away from people, from doctors, from staff. Actually, it's not true. AI is a very sharp tool which relies on information provided by us, and it refines the information to help us come to a better diagnosis and better treatment strategy. So I would say that rather than becoming slave to AI, you make AI your slave. Use it the way you want it to be used rather than they trying to use it the way they want you to. So it is an excellent tool to learn, an excellent tool to diagnose, excellent tool to guide your treatment to precision. But in the end, the mind behind the AI is human. So do not really get worried and let this evolve organically, and you'll be surprised that it's not going to be that bad as you find it to be.
Rightly said, sir. Like you said, that AI helps us in better diagnosis, better analysis, and we all are aware that in any point of time, AI can never replace the human intervention, especially the way doctors interact with patients, especially the trust doctor and patient have. I think doctors can take help in terms of analysis of AI tools, but the brain is of doctors, the heart is of doctors, the way to connect, the way to speak counsel to patient is only a doctor can do that. So I think that you very rightly said that make AI your slave rather than being slave of AI. So thank you so much for that clip, sir. So moving on, that we know that quality cardiac care is still a big challenge in tier 2 and tier 3 cities in rural India. People know what is heart attack, they have to rush to hospital and everything, but there's still many cases where these basic facilities of accessibility to healthcare is not there. So what steps do you think are needed from infrastructure training to bridging this gap to save more lives in remote areas?
So I believe that the government has a large responsibility, and we as a medical fraternity has a responsibility to contribute to that. So I believe that you need the entire machinery to spread information awareness amongst people. So create camps first for them to understand that what is the problem, how do you tackle it. Then create the infrastructure starting from primary healthcare to small centers which can administer at least life-saving drugs. So these are the middle centers. This model is working beautifully in Kerala and Tamil Nadu, where they have a spoke and wheel concept. So they have a big center tertiary. It's the center, and there are multiple spokes. There are multiple small centers which diagnose, and if they don't understand, they transmit the ECG to the main center, and then they get direction that at least give X and Y medicine, get his heart to start functioning better, and then you transfer him within a window provided, and they even facilitate transfer to the tertiary center. I think each state should go and study this Karnataka and Kerala model and see how they have managed to reach even the smallest of towns, smallest of village, and give them excellent care which is available in tertiary centers. So it's the responsibility of the government, our medical fraternity, to spread awareness, make such centers, and create centers of excellence so that transfer can be smooth and swift.
Thank you so much, sir. And I believe that our government is actually working towards it. We are seeing some rural camps being organized, a dissemination of information, awareness camps, education camp, and I think that's how we can create that sensitization towards this.
Sure.
Uh, so as we have come to end of our discussion, but we would not let you go before you give us a final closing remark, a message to our audience, some actionable steps you would recommend to our viewers to take care of their heart
Right.
health and their family's heart health.
So the message on World Heart Day would be especially to the youth, not that it does not apply to everyone else, it applies to the youth more because they are the ones who are the future, who are the ones who are going to lead the nation to a future and also at a higher level, they need to protect their health. They need to protect their holistic health, not only the heart. So they need to protect their mental, their spiritual, their physical, their economic, every health they have to protect. And the best way to do is, one, be aware of yourself. Temper your expectations. Is good to be aspirational. Do not be running behind only money. Run behind excellence, money automatically follow. And once you run behind excellence, your stress levels are much lower, because then you're not competing with your compatriot. You're only competing with yourself, that I will be a better version of myself. So the stress goes down by such ways. Another way to reduce stress is to think of doing some kind of meditation, build some activity, exercise regularly, keep away from addictions, check your sugars and blood pressures if your family history is high, so that you are treated in time to prevent heart attacks. And last but not the least, sleep well.
Thank you so much, sir, for highlighting those important points of how we can keep ourselves and our family heart healthy. It means a lot from you that you guys, doctors are there, cardiologists are there who are helping us to, create that education, that awareness amongst us listeners on this special occasion. Thank you so much for your time and for your valuable advice, sir.
Thank you for having me.
Thank you so much, sir.
Thank you.